my name is Kylie Rawls, and I will be sharing a presentation with you today on myocardial infarctions, also known as heart attack. This is for my bio class, Bio 166 W1 with Mrs. Watts. So, a myocardial infarction, also known as a heart attack occurs when one of the heart's coronary arteries is suddenly blocked or suddenly has extremely slow blood flow. A blockage is caused by a clot formation known as a thrombus or a traveling clot known as an embolus. A clot can travel to the brain causing a stroke, the heart causing a heart attack, or the lungs causing a pulmonary embolism. Signs and symptoms of a heart attack would include severe chest pain. Someone might be clenching their chest. So they would describe it as heavy pressure. They would complain maybe of some left shoulder or arm pain. They can complain of back pain, jaw pain. Symptoms of indigestion can commonly could mask symptoms of a heart attack. They may be really lightheaded, sweating, pallor, dizzy, might complain of nausea or vomiting, feelings of palpitations. Causes of a heart attack would be atherosclerosis, which is a disease causing a narrowing of arteries due to plaque buildup within the artery walls. That would look something like this, like a healthy artery would be open and blood flow would be going through as normal, and in atherosclerosis you can see here blood's trying to go through, but the plaque buildup has gone inside the walls, therefore the narrowing can cause an occlusion, and it can clot up here. High cholesterol, which would be the plaque building up into those walls, smoking, diabetes, high blood pressure, high levels of stress, physical inactivity, obesity, a family history of coronary artery disease, drug abuse, and clotting disorders. The pathophysiology, well, the heart is the major organ that's affected. It is caused by a gradual or sudden decrease in blood flow to the heart. Atherosclerosis is the #1 contributing factor of MI. It is a disease, so like I said, is a narrowing of the arteries caused by a buildup of plaque that's deposited inside the vessel wall, which increases your chance of having MI. When the plaque ruptures, forming a clot in one of the heart's arteries or vessels, blood flow is either decreased or completely stopped, causing ischemia, which ischemia is death of the cells. So as soon as that starts happening, the heart muscle starts to die, and in the hospital we say time is muscle. So if there is no immediate intervention that is done, death is usually occurs pretty quickly if there is no immediate intervention. And if you are able to get treatment, you probably have some lifelong issues. Diagnosis and lab testing. So diagnosis, when they first come to the hospital, patient complaining of those symptoms, they would be hooked up to a cardiac monitor. We would get an EKG showing their heart rhythm, and we would be looking for ST elevation. So a normal heartbeat would look like this on an EKG. This segment here is called the ST segment, and if they were having a heart attack, it is called a STEMI. So your ST elevation right here, your QRS, and here's your T, and here's the elevation right here. That is indicating of an active heart attack. Now, if someone might have like a rhythm looking like this, but we would also be checking their troponin level. Troponin is would be elevated in the event of that they had a cardiac event. They would also get probably an echocardiogram following the event, and like I said, for immediate intervention, they would be getting a cardiac stent. The stent would be They usually will go through the femoral artery or radial, and the patient is awake during this. They'll go through there up to the heart and put a stent in the blocked vessel to open it back up to restore blood flow to the heart. Prevention, well, eating a healthy diet, maintaining a healthy weight, lowering your cholesterol, your blood pressure, going out for regular exercise, refraining from tobacco or drug abuse. Medications to help prevent that, if you were at risk, would be like taking a blood thinner, antihypertensive medications, or cholesterol lowering medications. Treatment, so in the emergency room, when a patient comes in with signs or symptoms, we usually go by a monogram called MONA. It stands for morphine, oxygen, nitrogen, and aspirin. Morphine to help with the pain. Oxygen will help increase your oxygen to help get in for that blood flow to that heart. And the nitroglycerin will actually is a vasodilator and helps dilate those vessels that are being constricted to get blood flow to the heart. And aspirin, which is like a blood thinner. There are cases where you would not give nitroglycerin, depending on where the heart attack is happening within the heart. Normally, you would see in a heart attack a high blood pressure, but there are cases where in an inferior MI that they would have a low blood pressure. So in those cases, you would not give nitroglycerin because it would drop their blood pressure significantly. Doing the opposite of what we actually want to do is to at least get blood flow to the heart. In the event of a active heart attack, patient would be treated with MONA, so the morphine, oxygen, nitrogen, nitroglycerin, and aspirin, and then heparin. The patient will be getting an IV with a bolus of heparin, which is again a blood thinner, antiplatelet drug to help dissolve that clot. After that bolus, they would also be given a continuous drip infusion of heparin. That would all be being done while getting set up transport to the cath lab where they can get cardiac stent placement. After MI, a patient would be most likely put on a blood thinner. If they have high blood pressure, be put on an antihypertensive medication. Typically, you'll probably see high cholesterol with that. Also vasodilators, they'll be giving nitroglycerin to take if they're having chest pain at home or out and about. It's given sublingual every 5 minutes times 3. And they would need to be following up with a cardiologist. A little bit of history. In developed countries, acute MIs actually account for 10 to 25% of all deaths. About 5% of heart attacks occur in young people under the age of 40, particularly on those with major risk factors to develop atherosclerosis like hypertension, diabetes, cigarette smoking, with a high cholesterol, and a family history. An MI can occur in all ages but are more prevalent in the elderly. Males are at higher risk than females. And most patients die within the first few hours of onset, while remainder suffer from effects of impaired cardiac function. To wrap up my presentation, heart attack is a medical emergency, and one should seek immediate medical attention. It is really important to understand and to know and be able to identify signs and symptoms of a heart attack, because it could very well be someone's life that you are saving, and to call 911 immediately. It's also important to maintain a healthy lifestyle, monitor your blood pressure, and know your family history if you are at risk. Again, like we like to say, is time is muscle. So time is of the essence, and it is important to contact your emergency personnel as soon as you can. And that is it. Thank you for watching.